April Rose Ibanez, and in this video, I would like to demonstrate all about the clinical assessment or the clinical examination of the 12 types of cranial nerves. So with that, I'm going to use a patient. And speaking of patient, here on my right side is Ashley. Hi Ash, how are you doing?
I'm good.
Well, thank you. So are you ready with the examination and assessment today?
Yes.
So first, I'm going to demonstrate or examine your 12 cranial nerves. I'm going to test first the first type of cranial nerve, which is your olfactory. So olfactory is responsible for the sense of smell. So have you noticed any differences or difficulties of your sense of smell? So that's good. Thank you. And the second type of cranial nerve is your optic nerve. So in optic nerve, I'm going to test your visual acuity. In visual acuity, I'm going to lend you a book, and with your right hands covering with your right side of your eye. So can you cover your hands and your eyes? And can you please read these words from the top of the word for me?
No, noise, vibration, energy, weather, electricity, radiation, and pressure.
Okay, that's correct. Thank you. And the second one is your visual fields. In the visual fields, again, I'm asking you for you to cover your left side of your eye with your left side of your hand, and tell me if you sense or see my hands moving.
Yes. Yes. Yes.
Okay, thank you. The third one is the oculomotor, and the oculomotor is to check the normal resting of your eye, and its normal movement. So I'm going to place the pen at a distance, and I want you to focus on the pen. So I'm going to move this, and you have to follow the pen. Okay. Do you notice or do you have any double kinds of visions or anything? Okay, that's normal. So the fourth type of cranial nerve is your trochlear nerve. So trochlear nerve, it innervates your superior oblique muscles. So still a pen, I'm going to examine again. You have to focus on the pen, and I'm going to put it closer in your eyes. So again, focus on the pen. Okay. So do you experience double visions or do you?
No.
So no, thank you. So the fifth one is the trigeminal. So in a trigeminal nerve, it composed the both component of sensory and motor. So in sensory component, it touches the ophthalmic, maxillary, and the mandibular divisions. So in this sensory, I'm going to examine. Okay. Tell me at the end if you feel the same sense when it touches. Did you feel symmetrically?
Yes.
Thank you. And in your motor component, I'm going to touch your temporalis. Okay, this is the temporalis. This is the masseter. Okay, this is your jaw. And now, can you move your jaw side to side? Again. Okay, thank you. So that is the function of the motor aspect of the trigeminal. So the seventh one is the facial. So then the facial is responsible, of course, for the facial expression, and it contains the buccinator. So I'm going to examine it. So can you raise your eyebrows for me? Okay, thank you. If we see wrinkles here, it is because of the contraction of the oblique muscles, and it should be symmetrical. Okay, thank you. And now, can you close your eyes entirely? Okay, this is the orbicularis oris, and this is the function of the orbicularis oris. Okay, thank you. Now, can you clench your teeth for me? Clench. Thank you. And can you blow your teeth? So this is the box here. I'm going to roll it gently. So this is the function of the boximeter. So the eighth type of cranial nerve is the vestibulocochlear. So in this type of cranial nerve, simply just it is responsible for the hearing and balance. So simply, I'm just going to whisper some words and you're going to tell me what is it. Okay?
22. 36.
Okay, that's good. That's correct. So the glossopharyngeal is the ninth type of cranial nerve. So in glossopharyngeal, it contains it's all about the sensory, which is responsible for the touch and taste onto the back of the tongue. So Ash, can you open your mouth, please? Taste it. Say Okay. So that is all about the glossopharyngeal. Remember that glossopharyngeal, it is all about the sensory, or responsible for the touch and taste. So the 10th one is all about the vagus. It is a type of cranial nerve. So I'm going to show that using a cough test. So it contains the sensory to pharynx, larynx, and the sclera to water palate too. But despite of that, I'm going to show it simply by using a cough test. Okay, so Ash, can you give me a loud cough? So that is what you should know, that it is the type or the function of the vagus. So now let's proceed to the 11th type of cranial nerve, which is the accessory. So in accessory, it innervates the sternocleidomastoid or sternocleidomastoid in your trapezius. So Ash, can you shrug your shoulders for me? Yeah. Yeah. So I'm seeing the elevation, symmetrical elevation here in your because of the trapezius. And Ash, can you move your face against mine? Now I'm seeing here the sternocleidomastoid. Again to the right side. I'm seeing now the sternocleidomastoid. So that is 11th type, which is the accessory. The last part of the type of cranial nerve, which is the hypoglossal. So hypoglossal, it innervates your extrinsic tongue muscle. So now we're going to examine it using Ashley. So Ash, can you protrude your tongue? And can you move it to both side by side? Okay. That is examination. One week examine all about the hypoglossal. So thank you for watching our examination and a simple basic type of examination of the 12 types of cranial nerve.